Welcome back to Creating Hope, a half-hour show brought to you by the VCU Medical Center. I'm Mandy Setliff. We've already talked tonight about how Massey's new laboratory is creating hope through science, taking research from these benches to the bedside. In our next story, we meet a couple of patients who wouldn't be here today if not for the technological breakthroughs going on at Massey. Not much intimidates Carla Battle. She's used to plowing past obstacles in order to reach her goal. But when she learned she had breast cancer, she was completely unprepared.
I'm healthy, I run, jog, aerobics, run around with my kids. I had no clue, blindsided with this. It was really hard.
She presented initially with a very large tumor and began chemotherapy to treat the tumor because it was too large to be considered for a lumpectomy.
In fact, even a total mastectomy would have been difficult.
Left breast nodules.
Dr. Baer and the rest of the breast health team get together every Tuesday. All the specialists meet in one room to discuss each patient one at a time.
She's got a lymph node there that looks very suspicious.
When you have everybody at the table, the information is heard in the same way, and then it's discussed and a decision is made jointly by a team in terms of what the treatment options are for that patient and which are the best.
Dr. Cardenoza is VCU's Director of Breast Imaging.
My job and my goal in life is to try to find cancers as small as I can find them. The smaller I find them, the better the chances for the patient.
Historically, breast imaging has meant mammography, and it's still the standard by which many early breast cancers are found. But in the last 15 years, more tools have become available.
Breast ultrasound, imaging-guided biopsies that can be done using mammography to guide the needle placement or using ultrasound. And more recently, we now have magnetic resonance imaging, a very powerful tool in the search for early breast cancer.
An MRI can provide more detail about blood flow, which may indicate potential malignancy, and it can sometimes find smaller lumps. But it's not just about one diagnostic tool versus another. It's about helping patients emotionally as well as physically.
When I tell a woman, yes, that little lump we found on your mammogram is cancer, I can immediately have them see somebody who can then pick up the care and tell them what the next steps need to be.
For Carla, it was pre-surgical chemotherapy, followed by a mastectomy, then radiation.
She had a type of disease that 10 or 20, at least certainly 20 years ago, almost no one survived with this kind of presentation. And now, because of the kind of altered sequencing of treatments and combined modality treatments with surgery and chemotherapy and radiation, her chances are much improved.
Just to get back now to play soccer and to go to aerobics and to lift weights, I feel like a whole new person.
The multidisciplinary approach to Carla's care is a central theme to all cancer care at Massey, not just breast cancer.
Just so that you'll appreciate some of the gizmos in here. So this was what was treating you.
Okay.
And then off behind you, you can't see it right now, but are some additional x-rays that came out and did some positioning.
Dr. Stan Benedict is the physicist behind the gizmos. In this case, the combination of Trilogy, an image-guided radiation therapy system, and ExactTrack, the robotic X-ray positioning system that adds a fourth dimension to this one-of-a-kind radiation treatment.
This device has all the capabilities to make sure that what we simulated is what we are going to deliver. And we can verify that. And we have a host of imaging by being able to say, I can see it, I can treat it, let's go.
I'm glad I was in the right place at the right time to be able to use that. It was scary. It was, I had a 18-month-old baby at the time. Excuse me, she was 9 months old. And I wanted her to know who her father was and all that. And I thought, well, I'd like to live till she's at least 5 so she can relate back. And I've been very lucky. She's 14 now, so.
John Lawrence has been battling a series of brain tumors since the early 90s. He's had plenty of chemotherapy, surgery, and radiation. In fact, he's had so much radiation that his physicians were concerned about giving him any more.
The beauty of this system is that when the so-called whole brain has already gone to tolerance, it's already received the maximum dose that you would be able to tolerate, we can actually target these very specific gross tumor volumes and minimize any kind of collateral damage directly associated with that.
So with Trilogy, healthy tissue isn't harmed, and neither are important structures surrounding the tumor.
I think we're in a unique position here to really define tumors and critical structures that are adjacent to them, and really get a shot at controlling the tumors that we couldn't control previously.
The Trilogy system actually incorporates robotics, and that's an important key feature. We don't necessarily just rely on the human eye, but we're also relying on very sophisticated computers that help us, that aid us in moving the patient into the proper position. That's what I like to call perfect.
And unlike with other systems, Trilogy patients don't have to wear a frame bolted to their head to hold them steady during the treatment, just a mesh mask that fits over the face.
It's totally painless. I mean, there's no recuperation. I had no side effects. It's nice to have that kind of facility, that kind of expertise this close to you.
And another happy ending to Mr. Lawrence's story. He's getting married in May, so congratulations to him and his fiancée. Now, if you have any questions about what you've seen so far, give us a call at 1-877-4-MASSEY, or you can visit Massey's website at massey.vcu.edu. We'll be right back.